Young girls, 20, 30 years ago with cystic fibrosis were told not to plan on having children.
I think it's probably the worst for him.
Thankfully, this has changed, and certainly we have many women with cystic fibrosis who are able to give birth to very healthy children.
Over 3 weeks now, he's been at home, and then he's at Nana and Papa's house, and then he's visiting Mommy in the hospital.
In the classic patient with cystic fibrosis, the problems include recurrent pulmonary infections, basically difficulty clearing secretions out of the lungs, which leads to pooling of secretions in the lungs, recurrent infections with certain organisms, typically Pseudomonas aeruginosa, which is a very resistant organism, and it acquires antibiotic resistance.
This is your PICC line here.
Medicine goes in through here. Yeah, medicine goes in through here.
They're going to have numerous doctor's visits to see a pulmonologist, an infectious disease specialist, or an endocrinologist. The average life expectancy for cystic fibrosis keeps increasing. Unfortunately, the average age for somebody born today with cystic fibrosis is still just under 40 years.
8 years old?
Mm-hmm.
Seems like just yesterday you were 7.
I was. You filming me?
Yes, sir.
But if you could give me an idea
Typical.
of your typical treatment on a day-to-day basis.
The patient with cystic fibrosis has to abide by a regimen of aggressive pulmonary toilet and mucociliary clearance using medications like Pulmozyme, which breaks up the DNA in the mucus. In addition, the CF patient would typically need to use either a chest physiotherapy vest or manual chest physiotherapy. Patients have to take pancreatic enzyme replacement to properly metabolize food. A typical patient would take aerosolized antibiotics, tobramycin or Toby. They might also need antibiotic pills such as Zithromax. They may need to take a regimen for diabetes such as insulin, nasal sprays or nasal rinses. They have other problems like osteoporosis. They might need additional medications like calcium supplements. Many of our patients want to be compliant, want to do what's right, but it just takes hours out of the day to take all of these medications, and certainly that can be a very difficult financial burden as well. These are young patients who should be able to focus on school, on social relationships, and traveling and just having fun. And instead they're forced to take all these medications really just to stay alive.